So good day, ma'am and sir. I am Godal Estramboyang, student nurse from University of St. Anthony, and today I am going to perform the DR technique. So the first thing to do is to assess the patient. Assess the patient for capabilities and cooperation. Also, check the clients for the second stage of labor. Check the cervix if it is fully dilated or fully effaced. Also check for the urgency to push, and also check for if the amniotic membrane is already ruptured. Assess the vital sign or check the vital sign and fetal heart tone, and also check for the temperature of the room and air draft. Prepare the DR table, position stirrups, places the Kelly buckets and the ghost neck lumps if necessary, and gather all the equipment. So after gathering all the supplies, introduce yourself to the client and identify the client's identity. Transfer the client into the DR table and position the client in a lithotomy position, and then drape the client properly. Explain the procedure to the client and the proper bearing down technique, and ensure the safely in the DR table. So washes your hands thoroughly and observe proper procedure. Perform perineal preparation or disinfection using appropriate technique. So after performing perineal care or perineal care, washes your hands thoroughly again and wears 2 layers of gloves, and then encourages and coaches the patient on how to proper bearing down technique. So apply perineal support on cephalic delivery, Mertens maneuver, and feel for presence of cord coil upon external rotation of the head, and catches the head with non-dominant hand. So instruct the client not to push when head is delivered. Delivers the anterior shoulder by slightly pushing the head down. Grasp the infant's thigh securely with the non-dominant hand, and note the sex and time of the delivery of the baby.
Places the baby on a clean, dry cloth or towel on the mother's abdomen. Thoroughly dry the baby for at least 30 seconds, starting from the face down to the lower extremities of the baby. And then perform Apgar scoring at 1 minute of life, then repeat after 5 minutes. So remove the wet cloth or towel, then apply bonnet on newborn's head. Then places the baby on skin-to-skin contact on the mother's abdomen. Instruct the mother to hold newborn securely with her palms. Covers the baby with a clean, dry cloth or towel. Then removes and discard outer layer of the gloves. So assuming that this is the umbilical cord of the baby, so palpates the umbilical cord to check the pulsation. After pulsation has stopped, clamps the cord using the sterile cord clamp at 2 cm from the base and another sterile clamp 2 to 3 inches above the cord clamp. Cut the cord using a sterile scissor near the cord clamp, not midway. After that, check the cord for presence of 2 arteries and veins. So, administer oxytocin to the mother's deltoid. Performs the remaining steps for the active management of the third stage of labor. Observes for sign of placenta separation, sudden gush of blood, lengthening of the cord, fundus of the uterus rises, becomes firm and globular, and also examine the placenta for completeness and abnormalities, disposes the placenta in a leak-proof container, inspect the vaginal vault and perineum for presence of lacerations, tears, and assist with repair of lacerations. So, administer vitamin K, Hepa B vaccine, BCG vaccine as per doctor's order, and explain the rationale of above.